Hi, everyone. Thanks for joining us today as part of Interventional Mindset. Just to give you a little bit of background, we have created this educational initiative to help clinicians bridge the gap from actually learning about tools and technology and implementing them into their clinical practice. And today, Dr. Gary Wortz and myself are going to talk about astigmatism management. Gary?
Yeah, so astigmatism has been one of those things that from even when I was a resident, it was a little bit mysterious on how to treat. I heard about these LRIs, toric lenses were just sort of coming out when I was in training. And so when I came out, really, I didn't think about correcting astigmatism until a patient had about a diopter or more. So really more than half of my patients, maybe up to 60, 70%, I didn't even really think much about correcting their astigmatism. But once they got to about a diopter, I started offering toric lenses. And the ones that took me up on it, clearly I was comfortable with toric lenses. But once I got a femtosecond laser a little bit later in my career, I started realizing that we had a new tool and we had the opportunity to possibly help patients with lower levels of astigmatism who wouldn't necessarily benefit from a toric. So Preeya, what is your approach when you're looking at a patient with less than a diopter of astigmatism? How are you determining what you're going to do?
Well, Gary, I think you're highlighting some really important things, which are that astigmatism management isn't necessarily straightforward for clinicians. And when we think about astigmatism management, certainly I'm right there with you. Higher levels of astigmatism are benefit from toric IOLs, but lower levels of astigmatism are very much meaningful. You and I recently published a paper that showed that managing low levels of astigmatism, so we're talking about less than a diopter of astigmatism, actually leads to more patients achieving 20/20 uncorrected visual acuity.
Yeah, we actually showed that it was almost a 200% increase in 20/20 uncorrected patients, and over 350% increase in uncorrected 20/25. I was actually really, in some ways I was surprised that the numbers were that different. I had been noticing for a while that it seemed like my femtosecond laser patients who had a monofocal lens and arcs really did quite well. They were getting really close to, planosphere. And it wasn't until we looked at the data and studied it that we were able to validate that, yes, indeed, treating lower levels of astigmatism and having a plan for those patients is going to give them that refractive outcome that they're frankly looking for and usually paying more for also. So the problem I think that you and I both we've talked about this in the past, was how do you know what to do? How do you know what size and location? I mean, there's so many tools that are out there. It's almost a paradox of choice of which nomogram do I use? How much do I cut it back by? Am I going to be in danger of over treating someone? I've done all those things. I've made all those mistakes. So Preeya, what are your thoughts on tools? And maybe you can talk a little about what we've done to try to make it simpler for folks.
Absolutely. Well, first, I'd love to just start by kind of reviewing my process for astigmatism. So, before I even walk into a patient's room, I look at their topography and I look at their biometry. We're using both the LensStar and the IOL Master in my clinic. And I look at their magnitude of astigmatism and the axis of astigmatism. So as we've been discussing, when patients have higher levels of astigmatism, I lean towards a toric. For lower levels, I'm mostly using the femtosecond laser and creating arcuate incisions. I think the femtosecond laser places those incisions more precisely in a more exact shape and exact depth, because you're using OCT to help with the placement. And there's a couple of key things that I look at. From a corneal perspective, I'm looking at whether or not they have any irregularities like Fuchs dystrophy, anterior basement membrane dystrophy, pterygium, anything that could give me irregular astigmatism. So for that patient that has a normal cornea and has low levels of astigmatism, my process from there is to use the femtosecond laser. Traditionally, I was using formulas that really haven't been approved for femtosecond laser use. And it's through time and, kind of that like black box as you talk about it, where you're like, how does so-and-so figure out how they're going to make their incisions? And, you have thousands and thousands of cases as well under your belt. And it's that secret sauce, is really shouldn't be a secret.
Right, exactly.
And so today I'm using the nomogram formula that we created, the Wortz Gupta formula. It is readily available on lricalc.com. And it is really founded from that Sentinel paper that we put together. And so the goal of it really, in my mind, should be that astigmatism management should be something that you think about in every patient. I know that as I had greater and greater adoption of the femtosecond laser, it's something that naturally was a natural progression. I paid more attention to astigmatism, and this formula and the calculator website, it's very easy to use. The last thing you need is 100 pieces of data and an extra 2 hours to plan your surgery charts, right?
Right. And I think that because you and I both are surgeons using this tool, we wanted to create it in a way that was so foolproof that data entry was going to be minimal. You have a place to put a patient number. You can select the right eye or left eye. You don't enter Ks. You can just enter the amount of astigmatism, the axis, and the patient's age. Hit calculate, and you're done. And it provides a nice graphical interface that shows where the incisions will be placed. In this calculator, something that's very different, I think a little unique from other calculators, we are holding the incision constant always at 0 or 180. So we're always going in from a temporal approach. I know that's a little bit different. We don't have an area for SIA, but we validated this and we both are using it with great results. And we'll probably be having a video shortly that discusses exactly how to use the calculator, and we'll show it as well. So I think this is going to really simplify a very complex problem, and that's something that I'm really passionate about. And I think with interventional mindset, that's really the focus, and the goal is that we are surgeons. We have the ability to intervene with patients to fix and solve problems. And we want to bring education and tools to our fellow surgeons so that we can get the best possible patient outcomes for the benefit of our job satisfaction, frankly, and the benefit of our practice. So Preeya, I just want to thank you so much for starting this. It's been a pleasure to work with you on it. And I know that this is just a small hint of what's to come.
Absolutely. Well said. And for all of you out there, we hope that you check out the lricalc.com website, and truly just hope that you approach all of your cases with the mindset of treating astigmatism, because your patients will be seeing better, and you'll be happier because you're delivering better outcomes. Thanks, everyone.
Thanks.